Okay, before start the sharing lecture today, I will introduce myself. My name is Ayuni. I'm pediatric nurse lecturer in Akademi of Nursing, Pelni, Jakarta. I'm as a host today. I will guide this sharing lecture program from beginning and end. Okay, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, ladies and gentlemen, all participants in this Zoom meeting. I hope everyone is in good condition and stay alert regarding the COVID-19 pandemic for Omicron virus, especially in Indonesia. No cases are increased every day. Maybe in Malaysia too, right, Miss Premila? Okay.
Yes.
Okay, thank you. Welcome to Honorable Miss Premila from MAHSA University, Malaysia. Welcome Honorable Prof. Reza as a Managing Director, Mandala International Education Institute. Welcome Honorable Miss Buntar Handayani as a Director of Akademi Nursing, Pelni, Jakarta. Welcome Honorable Miss Fazar as a lecturer of Medical and Surgical Nursing, Akademi of Pelni, Jakarta, and all staff and student Akademi of Nursing, Pelni, Jakarta. Okay, anyone know what we will doing in this Zoom meeting today? Yes, today is the day we'll be waiting for. We will get information and increase our knowledge about application evidence-based nursing in diabetes nursing care. We have two speakers today. First, Ms. Premila from MAHSA University, Malaysia. And second is Ms. Fazar from Akademi of Nursing, Pelni, Jakarta. For Ms. Premila, welcome to this Zoom meeting today. Welcome to Indonesia by virtual meeting. I hope someday we can meet directly, right? You can come to Indonesia, especially to Akademi of Nursing, Pelni, Jakarta. Okay, before start the sharing lecture presentation, we will hear welcoming speech from Ms. Buntar Handayani as a Director of Akademi Nursing, Pelni, Jakarta. Ms. Buntar, time is yours.
Thank you, Ms. Ayuni. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
wabarakatuh.
Good morning, Ms. Buntar.
Good morning, Prof. Zahara, as Dean Faculty Midwifery of Nursing, MAHSA University. Good morning, Prof. Reza, Managing Director, Mandala International Education Institute. Ms. Premila from MAHSA University, Malaysia. All lecturers and staff and students of Academic of Nursing, Pelni, Jakarta, Indonesia.
Good morning.
Ladies and gentlemen, my name is Buntar Handayani. I am Director of Academic of Nursing, Pelni, Jakarta, Indonesia. It's my great pleasure to welcome all you in this Zoom meeting for sharing lecture from MAHSA University, Malaysia, and Academic of Nursing, Pelni, Jakarta. The topic of international sharing lecture today is evidence-based nursing in diabetes nursing care. As we know, diabetes is one of 5 non-communicable diseases, leading causes of death globally. So diabetes is problem in the world. As a nurse, we need to know how caring diabetes patients, especially based of evidence, so that caring that we give to the and fully beneficial for the patient. There are several things that we need to know today regarding the care of patients based of evidence, or how to application evidence, how to application evidence-based nursing in diabetes nursing care plan. how managing diabetes during COVID-19 pandemic, and how managing complication of diabetes based of evidence-based nursing. The topic will be presented by Ms. Premila from MAHSA University, Malaysia, and Ms. Fazar from Akademi of Nursing Pelni, Jakarta. So today, we will get a lot of information from two countries, Malaysia and Indonesia. I hope this lecture sharing will increase our knowledge, especially regarding evidence. I also hope that by increasing our knowledge, what we have learned in this session can be applied especially to patients with diabetes and for development of their nursing profession. Enjoy for continue today events. Hope everything goes well. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Very good welcoming speech. Congratulations, Bu Buntar.
Thank you, Reza.
Thank you, Reza. Okay, I will remind all the participants again to fill the list attendant. Saya mengingatkan kembali kepada semua peserta untuk mengisi daftar hadir. For the link, we have to share in chat room. Untuk linknya sudah kami sediakan di chat room. So please fill the list of attendance in the link of the chat room. Okay, thank you, Ms. Buntar Handayani, for welcoming speech. Before I go to the presentation session, I will inform to all participants in this Zoom meeting when presentation time from speaker. If you have question, you can submit your question to Google form that to the link that I share in the chat room. Please submit your name, your status, question from whom, and your question in that link. You can use bahasa Indonesia and I will translate it in English. Bagi kepada semua peserta yang ingin bertanya ketika pemateri menyampaikan materi, maka dapat menyampaikan pertanyaannya pada link yang sudah saya kirimkan di chat room. Silahkan mengisi nama, status, kemudian pertanyaannya untuk siapa, dan pertanyaannya apa. Okay, thank you. Now, directly we will hear presentation from Ms. Premila. Ms. Premila will present two topics today. First is application of evidence-based nursing diabetes care plan. Second is managing diabetes during COVID-19 pandemic in Malaysia. Please welcome Ms. Premila. Time is yours.
Okay, thank you, Ms. Aini, for the kind introduction, and also for all the participants from Indonesia. It's my privilege to be here with you guys from another country of our neighbor country to interact with you. So first of all, I would like to thank Prof. Reza for giving me this opportunity to interact with you guys regarding this Zoom meeting. Yes.
Right.
So yeah, I'm just going to share the slides. So just let me know if you guys can see my slides.
Okay.
Okay. Your
Okay.
slide is
Is
very
it okay?
clear.
You guys can see my slide?
Yes.
Oh, that's
Very
good.
clear.
That's good. Okay, thank you. Thank you. So can everyone see my slides?
Yes.
Okay, perfect. So I would just like to introduce a little introductions of mine to you guys. I'm actually I'm a diabetes nurse educator from University of Malaya Medical Center. And I've been working in this industry for about almost going to be like 10 years from now. And yeah, seems now the situations in Malaysia, in almost in every Southeast Asian country, we are facing the pandemic, especially the current situations we are facing, heading towards to the Omicron. Even we also having the same issues in Malaysia, especially in Selangor, the state of one of the state in Malaysia, and also equally going up in KL as well. But the cases are actually going up more in Selangor. Okay, so how we actually going to manage the patients? Okay, the management of diabetes patient during this COVID-19 infections, I mean, during this pandemic. Okay, just little outline, how I'm going to present on. So all of us are very well known about the current pandemic issues about COVID-19. And I'm also going to cover on the link between COVID-19 and diabetes. Definitely all of us are well aware of what is diabetes is all about. It's one of the non-communicable disease. And the prevention and the treatment from nursing side, okay, and the entire summary of it, how we going to overcome this pandemic and how we going to treat our patients with the current situations. Yeah, so little introduction. Okay, as you can see, statistic from WHO, World Health Organization, which I got the latest updates as of on the 6th of February. So the confirmed cases actually really high. And of course, we still facing the miserable outcome. There is a death. And also, we also have people who get vaccinated every single day. And the other countries that surrounding that being facing together with us with this pandemic. So in Malaysia, okay, this is the latest statistic that I
Excuse me,
got it.
Ms. Premila.
Okay, really a lot. Yes.
Oh yeah, that's the video is stopped and your voice is not really clear, but now it's back to clear, right?
Oh, I see. Confirmed cases as of on the 6th of February was almost 2.92 million confirmed cases, and the confirmed deaths are actually 32K plus. And we do have patients, even though we get every single day we get a cases from the COVID-19, and also now we are facing the new Omicron virus, and these discharged from the wards and the hospitals, which almost more than 2 million. And total COVID-19 increasing, but yet the latest update of the cases as of yesterday, it was 17,134, which quite a bit increasing and is a bit worrying about. So yeah, we still emphasize our patients, we still educate our patients, advise our patients to get the vaccines, and then we do have our boosters now. But the sad part was, even though we get our boosters and the vaccinated, but still the cases are actually increasing. So the question here, where we need to overcome that. Okay, how are we going to overcome that? In what way we can encounter patient part for the patient? How none of the patients or the people are not following the standard of practice, the SOP. So how are we going to educate? So that's the one we have to reinforce. Okay, so the prevalence of the comorbidities in COVID-19 infection, as you can see here, with 46,248 COVID-19 patients show the most prevalent comorbidity, because if the patient is actually already diagnosed diabetes, what are the other comorbidity that come along with the diabetes? Definitely hypertension. Okay, sometimes we also call that tiga serangkai, which is the cholesterol, hypercholesterolemia, hypertension, okay, and also some cardiovascular diseases, the outcome. Okay, so maybe the patient, the percentage as we can see over here, it's keep actually rising. And not only that, patients symptoms as well. Okay, COVID-19. So what are the associate disease that belong together? Okay, what is actually the link between why we're actually talking about diabetes and now we are talking about the COVID-19? So what is the link between these two things? Yeah. Okay. People with diabetes are not more likely to get COVID-19 than a general populations. Okay. Okay, higher in the statistic. Why these patients are the main target? Because all these people like diabetes, so their immune system is actually slightly lacking. So they are very easily can get infected if their diabetic controls are not well controlled by themselves and the managements are poor. So they are very likely to get this COVID-19 and the percentages are very high. That's one. And of course, as we know, diabetes is one of the higher risk group for developing severe illnesses from COVID-19. So when they get this infection, what are they get some cardiovascular outcomes such as ischemic heart disease? Do they have any issues such as pneumonia or they have a stroke? So we have to link all those things together. And the risk of having worse outcome is almost similar for people and type 2 diabetes. In this world, we actually have a lot of different types of diabetes. Okay, but the very common diabetes that we used to talk about is type 1 diabetes, which this group are mainly depend on insulin totally. Okay, the type 2 diabetic is more towards genetic and the very unhealthy lifestyle. So those patients, but the risk of and the outcome from the COVID-19 infections for these both groups are equally the same. But of course, we have to depend, we have to see according to their age group, because those who are very elderly people, they are very prone to get these infections very often, and the management, if they really can manage very well, so the disease process will be much slower and they can actually recover much faster. Yeah. So this evidence is actually taken from American Diabetes Association, from web, ADA, we call it ADA. So, and also from CDC, yeah. Okay, what are the factors that are leading to high morbidity and mortality of COVID-19 in patients with type 2 diabetes? What are the reasons why they actually easily get this? Why they don't, why we are actually targeting this people, this group of people? As shown earlier of my slides, people with diabetes, they are actually immunocompromised, which are very unstable immuno level where they can easily get infection if they are not controlling their diabetic very well. So when this inflammation process happens, okay, they will get a very hyperimmune response where their immune system are not able to fight with the infection of COVID-19. So when suddenly they'll get the sugar level will fluctuate, and then so there are a lot of other chemical reactions happen within their body. And furthermore, when they get this COVID-19 infection, definitely it makes the situation even worse, where they're really not able to control their diabetes, because in Malaysia, we have actually categorized people with COVID-19 in Cat 1, Category 1 to Category 5. So the Cat 1 is still manageable. Cat 1 and Category 2 is still very, very manageable, where they need to get quarantined themselves at home. And after the quarantine period, they just can resume back to work. Usually, we have to see the level of infection. So those patients, we need to let them to get admitted. They have to get treated intensively to reduce the infection. So maybe there is a prolong of staying in hospital, and the usual, the patients on started with this steroid, patient's blood sugar level will be going up. So how are we going to treat with that? Because when the patients are the reason we started on the steroids of their lungs too, as normal as possible. So that's why they actually started on the steroid drugs, the steroid treatment. So definitely when the patients on steroid treatment, so their sugar level can be go and fluctuate and ups and downs, okay? So how we going to manage conservatively, okay? So we will come across in a while. Okay, so these are the something that is a repeated one, the pathogenic mechanism, okay? So definitely when the sugar is very high, okay, what will happen? As I say, the cardiovascular event, sometimes patients may get thromboembolism, and definitely cardiovascular outcome. And it is a very severe mortality. Okay, so clinical scenario COVID-19 pandemic, definitely the patients become very stressful and they will become so anxious, because none of us wants to get infected, because but due to all these unavoided circumstances, people are facing all those things. Okay, so when they become so stressed, and what are the things that they actually facing? Definitely, they really couldn't sleep, insomnia. Okay, and then they lack of exercises, or either these patients, when the sugar is so high, they will tend to eat much, or either they will just miss their meal, because people might be thinking, hey, only people who eat a lot, only the no. People, even when those things happen, there is a changes in diet composition, okay, among the patients, yeah, okay. And also there are some other things where people might start with the changes of the regimen. Sometimes patients might be thinking like, what's the purpose of I'm going to take the insulin or the oral anti-hyperglycemic agent? So they tends to neglect, they tends to ignore, okay? And definitely when they tends to ignore, what will happen? The compliance of medication accordingly will be disturbed. Either they will be taking their medication 2-3 days and they will be skipping, and then the frequency will be disturbed over there. Okay, and things happen, definitely the patient will miss out the appointment, the routines. It's not only that, even in my working place, we have faced these issues where during the MCO, during the quarantine period, so most of the patients, they actually couldn't turn up for the hospitals, couldn't turn up for their follow-up. So most of them, they have missed the visit to the clinical. So some patients, they need to continue medications. Some of the patients not even taken their medications. And when all those things disturb, definitely patients' blood sugar level will be not controlled. And definitely there is a delayed visit to emergency care or either diabetic control. Yeah. Okay. So this actually I've taken from the CDS website. Okay. From the Prevention in Diabetes Patients endorsed by Chinese Diabetes Society. Yeah. Okay. So what is the survival rate? Definitely, if the patients can able to control and they can track their sugar level, their blood sugar level accordingly, definitely the survival rate from the COVID-19 infection are very, very good. If they can maintain blood sugar like the target machine said, is depend on the range from the respective countries where fasting is the least applicable and it's the safest one. So definitely if the sugar levels are well controlled, so the survival rate is actually keep going up and it's very good. But if they also definitely the survival rates become more lower, and really the outcome will be the diabetes compliance issue, blood pressure, stroke, cardio increasing. Yeah. Okay. What are the prevention and the treatment method for our patients? Okay. This is actually something very simple as a nurse or as a healthcare provider. Anyone can do this. So what are the guidance for people with diabetes to prepare for COVID-19 infections? Sorry, there is some things that's actually gone up. Okay, people with diabetes should have already contact information with the healthcare provider. Okay, in Malaysia and in my working place, we have a system called something like what we are doing now. It's a Zoom meeting where we actually can interact with all of you guys here. But we do have we call it as a telemedicine, where the healthcare provider actually, patient can link together with us and also with the doctor. For those who are not able to visit to the clinic, so we actually interact with the patient virtually. So if there is any issues with the patients and regarding with their treatment plan, we actually liaise with them by virtually, by Zoom meeting. Okay, this is how we actually share the information here. And let's say if the patient's not able to collect their medications, because as I mentioned earlier, most of the patients during the MCO period, patient has actually missed their appointment and some of them not able to collect their medications from our outpatient pharmacy. So how are we going to get them enough stock medications for their treatment? So usually we will give an e-prescription slip to the patients so that they can get enough stock until the next appointment date. Yeah. Okay. Enough stock of simple carbohydrates. So let's say if the patients have acute complications such as hypoglycemia event. Hypoglycemia, as we know, low sugar, which happens among all our diabetes patients. Yeah. So how are they going to treat the hypoglycemia? Let us suddenly, if the patients develop low sugar, how are we going to educate? So we need to tell the patients to stand by with some simple refined sugary item. Okay, so how we going to educate them when they have this low sugar? So they have to stand by with this and how they need to take it accordingly. Okay, so we have to educate based on their need, because most of the diabetes patients require this education. This hypoglycemia education is very important, because when a patient keep getting hypoglycemia even frequently, it's not good for their brain and also for their heart. So all these patients can develop a lot of issues in the later stage. So if low sugar, what we need to educate. So ask them to have enough stock of all those things. This is not something that they can munch like whenever they feel so free, but this is for the emergency purpose. So we have to educate the patient. Yeah, that's one. And glucagon and ketone strip. Okay, glucagon is actually injections where usually type 1 patients will get it. This is something like the patients have very severe hypotension in the clinic, like less than 0.6 millimole per liter. So these injections will be given something like you're boosting by giving some glucose to your weight. This is something like that. Okay, that's why we always send these injections in the clinic. The patients are type 1 diabetic. These patients more likely to develop diabetic ketoacidosis, or we call it DKA. So these patients need to have the ketone strip, like how we all. So these are another type of strip where they can test themselves at home to find whether do they have any ketone in their blood. Okay, let's say if the patients have a ketone, because higher ketone is not good for their brain, they need to get hospitalized for IV drip infusion treatment. So we have to educate what are the things, as I mentioned from the Zoom meeting, virtual Zoom meeting, they must have enough stock. They must have enough stock for the hypo and everything. So these are the things that we need to educate our patients, yeah? Because this is something like a very essential, very, very important things that we need to educate. Any of the information that we forget to deliver to the patients, patient will have a very miserable outcome, yeah? Okay, okay, our friends all from Indonesia, so I'll try to put things in Indonesian. So, okay, so recommendation. So what you can recommend the patients, how we're going to educate the patient. Just now we have actually talked about the diet. They must have enough stock of medication, insulin, all those things. When it comes to COVID-19 infections, how are we going to overcome? How are we going to prevent the infection? So let me go on with the Malay. Okay, sering mencuci tangan dan hindari menyentuh wajah. Definitely, we are not allowed them, because as all of us are doing that, we are wearing the mask. Okay, the proper mask, the proper way. So make sure they sanitize their hand by using the hand sanitizer, or it's better if they can wash their hand and try. Ask them to not to touch with their, so ask them to sanitize. People with diabetic and they are very weak people, let them to stay in the house or home. Dia orang tidak berhadapan dengan orang lain, then they can get the infections from them. Okay, if let's say if these patients need to see or they have to go and see their family members, or they have to come to the hospital to see the doctor, let them to have a mask. Okay, atau pakai mask dia. Tapi in Malaysia, I think most in most country, masker satu mask yang biasa. Okay, kalau boleh the 3 layer, and on the top we wear the masker kain to have a double protections. Yeah, okay, and then it's very important, as I highlighted here, make sure patients take their medication, and if they're on insulin, make sure they take their injections according to their timing. Do not skip their medication, do not skip their insulin, because any of these missed injections or missed medication, they can lead to poor diabetic control, as we say. Okay. And then second thing is very important, make sure they take care of their diet. Okay. When it comes to diabetic control, there are only three things we always focus on. First, can hear? Okay.
Yes, you can continue.
First, I always mention, okay, fine. So we always make sure the patient takes their medication, ubat oral, kalau maupun ada injection, kita pastikan diet mereka adalah betul dan seimbang. Because when they not taking the proper diet, that's fine. But if the diet is actually compromised and they're not taking the proper diet, the diabetic diet, I would say, accordingly, so definitely the sugar is not that control. And the third thing is they must check their sugar on time. We don't need to check every single day, but we also educate the patient to check maybe in a week, like 2 or 3 times, depend on their needs. If let's say kalau mereka adalah tengah sakit, okay, then they have to do frequent. Orang kena check gula kerap kali. But if the patients are very well controlled, so they can do like 2 or 3 days in a week. As I keep mentioning, hypoglycemia. This is a very, very important thing, as I mentioned, because this is a very important complication we have to educate so that patients are not finding the miserable outcome. Kita tak nak pesakit tiba-tiba jatuh sakit disebabkan hypoglycemia, because we also got patients that got admitted because of severe hypoglycemia. Terus pengsan, cannot do anything, so we have to bring them to the hospital. Yeah, and if they really need anything to be shared with the doctor, they always can call the doctors if they are okay to be communicated with them, because usually in our working place, the doctors won't be giving their own personal number. Unless for the virtual Zoom consultation, yes, they will be allowed to call them to us regarding the medication. So is there any special instructions to be taken care of? So mereka boleh tanya lah, ya. Okay. Kedua, for patient yang dah ada infection daripada COVID-19, okay, what we can do is, okay, the assessment, okay, cari pertolongan medis secepatnya jika ada gejala, okay, flu or fever. Or some patients now, because of the Omicron, we have finding like most of the patients are asymptomatic. They are the symptoms. So what we can actually tell them in how to, how they can actually identify the symptoms to quarantine themselves. First of all, if they find any of this, they must quarantine themselves at home. Depend on the severity. If they develop with the symptoms, they should come to the hospital. Okay. But of course, with the proper SOP guideline, yeah, okay. And if the patients are already diabetic and the sugar is not well controlled, as I keep mentioning, make sure they take their medication, injections accordingly, so that gula dalam darah mereka agak stable. Kalau mereka miss kedua-dua benda itu, so gejala infeksi itu akan makin meningkat dan mereka akan lagi jatuh sakit. Sebab gula yang tinggi ini disebabkan oleh infection COVID-19 tersebut. Dalam mereka adalah pesakit diabetes, gula dah tinggi. Ini kan pula mereka telah mendapat infeksi COVID-19, lagi dia akan tinggi. So how we going to overcome that? Okay. And one more thing, and if the sugar becomes so high at home, they really can't manage well, and they already have diarrhea, sakit perut, ya, muntah, because ini adalah tanda-tanda gula tinggi dan dia orang tak boleh nak control, then we ask them to come to emergency to go and see the doctor, ya. Okay, management of people with diabetes with infected COVID-19. As I keep mentioning, make sure they take their medications, okay, with the proper advice from our physicians, our doctor, okay, oral anti-hyperglycemic agent, whichever they already on, okay, and sangat penting, very important, they have to check their sugar regularly, the finger prick. How frequent they need to do the blood test? So we have to tell them, okay? And with the standard rule of SOP, okay? How they going to manage the COVID-19 infections, okay? With the proper advice from our healthcare provider. And kalau gula dah tinggi, jadi kalau gula rendah, hypo, apa kita nak buat? Kita dah ajar. But gula tinggi, apa kita nak bagi tahu? What we going to advise? Make sure they have drink lots of water to bring the sugar from the body through urine. So kita kena ajar. Kalau gula rendah, apa kena standby? Kalau gula tinggi, apa yang kita kena standby? But yang penting, patient must be well hydrated with clear fluid, air biasa, ya. So they can take a SIM kalau mereka di quarantine ataupun home quarantine, ya. Okay, so this is actually something that I've actually come up with, and I've actually summarized this. So timely blood glucose management for the outbreak of COVID-19, novel coronavirus disease, urgently needed. So, if the patients are hospitalization tu adalah kategori yang serius, maksudnya critical case. Usually macam saya kata pada awal slide saya, di mana those patients they have to be on a steroid drug. So during the steroid drugs, gula dia memang akan tinggi rendah, sekejap tinggi sekejap rendah. So how we going to do that? Itu masa dia orang duduk di ward ataupun di home quarantine. Kalau pesakit itu telah disahkan discharge di rumah, bagaimana kita nak mengajar mereka? Okay, so that they don't interact with outside people. They still need to be quarantined at home sampai satu tahap yang diperuntukkan oleh pihak hospital. Pastikan mereka tidak interact dengan sesiapa di luar. Pastikan period quarantine tu habis, then only they can go outside to follow the standard SOP. Wear the double mask. Wherever they go, frequent hand sanitize or hand wash is very, very important. Yeah. So definitely kalau anda tengok di bawah column 2, these are the target range that we actually giving to our patients. Yeah. Kalau fasting, apa gula, target gula yang sepatutnya. Kalau 2 jam lepas makan, okay, ada target range. We actually orang tu muda, bagaimana sasaran gula mereka yang patut diorang kena target. Okay. Kalau orang yang 50-an, kalau gula tinggi, apa yang diorang nak kena buat? So we have to educate all those things to our patients. So make sure patient tahu apa yang buat. Okay. Okay, so this is masa during COVID, berhati-hati, ya. Ambil insulin, makan ubat, jangan kita skip, ya. Okay. So macam yang ni kortikosteroid yang seperti yang saya cerita, pesakit COVID-19 yang telah dimasukkan ke hospital ataupun dimasukkan di ward, okay. sebab mereka sudah ada masalah pneumonia, masalah respiratory. Okay, biasanya pihak hospital kita kebanyakannya clinical, they will start on steroid. Okay, seperti prednisolone ya, ikut praktis masing-masing di hospital sana. Okay, kalau pesakit diabetes yang makan ubat steroid ataupun injection steroid, gula mereka memang akan sangat tinggi. So bagaimana kita nak jaga gula mereka? Apakah treatment yang selalunya dilakukan ataupun dijalankan di ward masing-masing, di hospital masing-masing? Kita ikut protokol mereka. Okay, so tak payah macam setiap hospital, setiap setting adalah berbeza. So kita ikut protokol mereka ya, untuk bagaimana kita. Okay. Lepas tu ini adalah beberapa contoh insulin dan ubat oral, okay, yang kita ada. So we just leave it to our own clinical practice, apa yang kita makan, bagi patient kita makan, injection, sebab bukan semua pesakit akan cocok insulin ya. Ada kebanyakan pasien makan ubat sahaja. Okay. Ada setengah pesakit dia makan ubat oral dan kedua-dua injection. Dan sekarang kita ada beberapa suntikan, tapi kita bukan panggil itu suntikan insulin, tapi satu jenis suntikan di mana kita bagi pesakit ataupun pesakit nak ambil untuk jaga gula mereka. Tapi itu bukan insulin, ini macam seperti seolah-olah kita makan vitamin C untuk boost kita punya our immune system, right? Something like that. It's something like a supplement injection untuk bagi gula mereka dijaga pada paras yang bagus. Ada juga, okay? Tapi terpulang pada umur pesakit yang tertentu saja kita bagi. Bukan seperti itu ya. Okay, so it's just a repetition. Okay. Macam pesakit kalau ada injection, so kita kena ajar yang sepatutnya pesakit type 1 diabetes seperti yang sebut awal slide saya, mereka bergantung kepada insulin 100%, 100%. So bagaimana kita nak ajar cara suntikan yang betul, ikut dos. Okay. Seperti anda nampak dekat dalam gambar, saya rasa ini kebanyakannya kita dah very familiarized. Kita panggil ini insulin pump. Insulin pump ni akan jalan 24 jam. Okay. So ini memang agak mahal kosnya, tapi ada beberapa pesakit, kebanyakan negeri di Southeast Asia, ramai pesakit pakai yang ni, terutamanya pesakit type 2 diabetic, type 1 diabetic ya. Selalunya di kalangan kanak-kanak, di kalangan remaja, mereka pakai sebab dia orang tak suka cucuk banyak kali, so mereka prefer yang ni. Tapi benda ni memang mahal, so banyak proses dia orang melalui untuk memastikan. So seperti yang kata, bagaimana kita nak mengelola strategi kadar glukosa. Sama juga pakai insulin on time, makan ubat oral, anti-diabetic on time, dan konsisten. Konsisten ni sangat penting sebab kebanyakan pesakit mereka tak konsisten. 2 hari, 3 hari ikut, lepas tu dia orang kata tak boleh nak ikut ataupun dia orang kata forget. Sudah lupa. Tak boleh juga. So kita kena ajar mereka ya. So these are the something like kalau pesakit dimasukkan di ward, kebanyakan pesakit diorang akan pakai insulin mengikut infusi ya. So kita panggil IVI insulin secara regime IV drip. So dia ada dia punya range. So ini ikut protokol di ward masing-masing ya. Okay. So kalau pesakit itu keton sudah tinggi, gula tinggi, apakah protokol ni? Tapi dia ikut clinical setting masing-masing lah. Sebab hospital saya setiap di ward macam masing-masing ya. Ini saya just tunjukkan contoh sahaja dan benda-benda ni macam a bit complicated. So kita just ikut sahaja, ikut hospital masing-masing ya. Okay. So ini yang pasal I cerita tadi pasal IBI insulin. Kalau pesakit itu terlalu kritikal ya. Kalau orang yang sudah kritikal sebab gula tinggi, biasanya pesakit itu tak boleh nak pakai insulin, dia orang kena melalui treatment IV drip infusion. Ya. So ini dah cerita. Okey, yang penting kita bukan saja jaga gula, kita kena jaga blood pressure, tekanan darah juga sebab kadang-kadang pesakit akan lupa buat benda ini. Dia orang cek gula tapi tekanan darah dia orang lupa. So benda ni pun kena check, okey? Sebab kadang tekanan darah mereka boleh disebabkan faktor-faktor yang lain. Mungkin dia orang tengah stres, gula dalam darah juga boleh tinggi, tekanan darah pun boleh tinggi. So kita kena bagi tahu ke mereka berapa kerat kita kena buat. Adakah kena pantau setiap 4 hingga 6 jam. Okey, kalau mereka di hospital, tak apa, kita ada nurse, kita ada our healthcare provider to do the blood checking, blood pressure checking. But di rumah, bagaimana dia orang nak buat? So pastikan mereka ada satu BP set monitoring dekat rumah supaya mereka boleh buat sendiri di rumah. Okay? Dan last sekali before I had the slide show, sedikit sebanyak. Okay. I nak conclude. Okay. Management of diabetes before 90, MAHSA energy. Apa yang kita akan buat? Kita akan buat saringan. Sebelum kita masukkan mereka ke hospital, kita kena buat saringan pada mereka. Selalunya kita akan pantau suhu. Okay, thank you. Dalam sakit itu memang disahkan
Excuse me, Miss Premila. It's freeze.
Hilang ya? Anu ya?
Iya, freeze. Oh ya, balik lagi ya. Okay, while waiting Miss Premila come back, I remind to all participants again to fill the list attendant in chat room. You can fill the list attendant now. Mengingatkan kembali kepada semua peserta yang ada di Zoom meeting ini untuk mengisi daftar hadir. Yang belum mengisi daftar hadir, mohon segera mengisi daftar hadir yang sudah disediakan pada link chat room. Terima kasih. Okay.
Okay. As you guys can see my slides, so just let me know if you can see my slides. Is it okay?
Not yet. We don't see
Not
anything
yet.
in the screen. Yeah, maybe you have to stop it first and sharing it again.
Okay, I'll do it again. Right? Okay, fine.
Excuse me. You have to
Yes.
share screen.
Oh yeah. Okay, so I'll start the things. So let
Okay.
me know if you guys can see my slides. Is it okay?
Not yet.
Oh, still not
Oh
yet?
yes, we can see. That's your screen is clear.
Okay, perfect. Okay, so good. Okay, fine. So we actually come to the last part of the talks where overall summary of how we're going to manage the people with diabetes in the time of COVID-19. So for an example, in my clinical settings, especially in my hospitals, when the patient comes with some infections or maybe they have developed with some symptoms such as flu, cough, or fever, so we will call it as a pre-arrival screening. So masa datang di trauma ataupun di emergency, bahagian kecemasan, ataupun dekat outside clinic, so we will do the screening. Pastikan suhu mereka adalah normal. Kalau tinggi, definitely we will not entertain the patients. We will let them to go back and quarantine themselves. Kalau mereka sudah ada simptom yang teruk, okay, apa yang kita nak buat? Sama ada kita kena buat swab test ke apa, kita akan buat juga. Depend on the patient's punya severity. Okay, itu satu. Boleh di quarantine di rumah. Okay, sebab kita ada dua things, how we going to manage them. So, kalau di quarantine di rumah, apa yang patut mereka buat seperti follow the SOP, standard of practice, sentiasa cuci tangan, sentiasa sanitize their hand, okay? Dan pastikan mereka quarantine because earlier of MCO, earlier of COVID-19, usually the quarantine period we actually give 14 hari, 14 days. But now we actually reduce, according to quarantine, 10 days. Some patients only need 7 days. It depends on the severity. Lepas mereka melalui saringan tersebut pada jabatan tersebut. So baru diorang akan, kadang pesakit tu mungkin pada kategori yang very mild, so mereka boleh quarantine pada tempoh yang agak pendek. Kalau mereka adalah pesakit yang sudah develop dengan simptom yang agak teruk dan kalau mereka memerlukan period of quarantine mereka perlu dipanjangkan, so mereka akan dinasihatkan seperti begitu. Dan kalau mereka boleh dikuarantin di rumah, apa yang mereka boleh buat supaya kawalan gula mereka pada parang yang normal, pastikan kita bagi education. Nasihat kesihatan sentiasa will be the first priority for our patients. So how they going to manage their diabetic at home? Pastikan mereka diberi alat meter. Kalau selalunya pesakit sudah ada mereka punya sendiri, kalau tidak, kita perlu educate mana mereka boleh dapat, dan how they going to test, how they going to do the things at home. And kita kena bagi informasi yang betul kepada pesakit. Okay, sebab kadang pesakit ni mereka rasa diri mereka macam dipulaukan, ya, sebab everybody scared because when they have a flu or cough, they will so scared about the COVID-19. So all of us when trying to jauhkan diri mereka, jauhkan diri kita daripada mereka. So how we going to advise them so that diri mereka dihargai, then how we going to educate? So we have to tell them, okay, kalau mereka adalah pada grup yang agak macam kalau mereka adalah orang yang kategori yang teruk ataupun pada golongan umur yang agak tua seperti 60-an, 70-an, okay, how we going to educate them? Okay, so we have to tell them. Kalau mereka tidak boleh dengar, mereka tak memahami apa yang kita ni, so we have to educate the family members, ya, so that apa yang family member, ahli keluarga mereka boleh bantu mereka, because the family support must be there. Without any family support, so these patients will be neglected. Mereka telah dipulaukan, mereka macam seolah-olah macam disingkirkan. So bagaimana kita nak menolong mereka? Ya, itu kalau kita nak bagi mereka jaga di rumah. Okay. Kalau orang tu ataupun individu itu telah mendapat simptom yang agak teruk, obviously kalau simptom sudah teruk, gula mereka pun akan jadi teruk juga, kawalan gula pun tak berapa kontrol. So how we going to educate them? Kalau gula teruk, apa yang kena buat? Okay, pastikan mereka ambil ubat, pastikan dia orang ambil suntikan insulin, ya, ikut masa yang tertentu. Kalau tidak memahami, kalau mereka masih tidak boleh melakukan, how we going to educate them to come to the hospital so that we as a nurse or we as a diabetic educator or as a doctor, how we going to help them? So if you notice this is like one big cycle. Dia macam satu kitaran, ya. So kita memang kena bagi tahu dan advise the patient. Just hold on, ya. Okay. Then conclusion. Sorry. Underlying diabetes mellitus risk, ya. Okay, keep going up. Okay, memang akan meningkat and keep going up. Okay, so kalau COVID-19 and diabetes, because as I say, both are actually linked together. Kalau kita dapat jaga gula mereka, kawalan gula mereka pada paras yang bagus, definitely the infection of COVID-19 kita boleh kurangkan dan kita boleh elakkan kadar mortality, ya, statistik mortality, ya. Sebab sekarang makin lama makin kes meningkat dan kebanyakan statistik kematian pun meningkat juga. So how we going to prevent that? Okay, satu, potential pathogenic link between COVID-19. Kalau COVID-19, tak semestinya orang tu patut ada diabetik, dia dapat COVID-19. Mungkin dia ada masalah lain juga. Okay? Maybe they got some other issues, ya. Inflammations or anything. Bagaimana kita nak tackle mereka, ya. So we have to advise them also. Lagi satu, during the COVID-19 pandemic, masa tengah COVID-19 ni, ya, dah lah tak boleh keluar dari rumah, kena quarantine. So how we going to prevent the complication? Selalunya ini yang kita kena fokuskan, sebab kebanyakan patient, dia orang tahu test gula, makan ubat, cucuk insulin, tetapi mereka tidak aware, tidak sedar tentang komplikasi yang akan tiba atau akan melanda pada mereka jikalau dia orang tidak jaga gula. Apa akan terjadi? Komplikasinya kita kena bagi tahu. Mungkin mereka boleh dapat luka, kalau Kalau luka tak baik, lambat sembuh, apa dia punya tu, kita kena bagi tahu, ya. Kalau dapat masalah buah pinggang, ya, ini semua adalah komplikasi yang terlibat akibat kawalan gula yang teruk, ya. So kita kena bagi tahu kat mereka macam mana mereka boleh jaga dan elakkan komplikasi ini, ya. Target gula yang sepatutnya, sasaran gula ikut daripada tahap yang normal, yang moderate dan severe. Kita kena bagi tahu kalau gula dia rendah, apa nak buat? Apakah sasaran gula yang normal dan apakah gula yang tinggi dan apa yang kita kena buat. So, dia seperti kita main seesaw, ya. Kalau gula tinggi, apa kita kena buat? Kalau gula rendah, apa kita kena target? Kalau gula mereka sentiasa cantik, bagaimana kita nak maintain? Pun kena ajar juga, ya. So kita kena bagi tahu education when it comes to bagi nursing education. So bagaimana kita nak educate, sebab every time we will focus on the nursing education, nasihat kesihatan tu sangat-sangat penting, sebab kalau kita lupa beri demikian, pesakit yang akan rasa sengsara diri mereka, ya. So these are some nursing diagnosis that I just picked up. Okay, just a few things. Risk for unstable blood glucose level related to insulin resistant. Insulin resistant adalah pesakit yang telah gula mereka sangat tinggi, di mana pesakit itu memang seorang pesakit yang kronik. Okay, disebabkan gula mereka memang tak berapa cantik, disebabkan fungsi beta sel telah kurang. Okay. Kalau risk of blood glucose, apa akan terjadi? So kita kena assess mereka, kita kena pantau mereka. Seperti yang kita kata, kita sentiasa pergi pada kitaran tu, ya. Kalau ada infection, tak semestinya COVID-19. Infeksi itu boleh dapat daripada masalah pernafasan juga. Ataupun pesakit dapat luka tu datang daripada infection tu datang daripada luka. Boleh juga. So kalau dia dapat infection, dapat luka lambat baik. So kita kena bagi tahu ke mereka. Dan nombor ketiga ni sangat-sangat penting, deficiency of knowledge. Kalau pesakit itu kurang pemahaman tentang diabetes, penjagaan itu, disebabkan kurang pemahaman, disebabkan kurang arif tentang penjagaan diri mereka, akibat COVID-19, akibat diabetes yang tidak berapa kontrol, apa akan terjadi? Kalau dia orang tidak cocok insulin, apakah outcome dia? Kita kena bagi tahu mereka, ya. Okay. Dan ini adalah yang something like sampingan, masalah sampingan. Tapi I always focus these three things for our COVID-19 patients, sebab we always talk about the infection, COVID-19 infection. So when the COVID-19 infection rises, blood sugar level also will be rising. Okay, so how we going to assess the patient? The knowledge education, ya. Kita kena bagi tahu. And okay. So when it comes to nursing intervention, educate. I keep telling this and keep repeating. Education. We have to educate the patient. Home blood glucose monitoring. Dah lah kena quarantine dekat rumah. So how they going to monitor blood sugar at home? Pastikan mereka ada kit itu untuk test gula di rumah. Dan kalau gula tinggi, gula rendah, apa kita nak buat? So we have to educate that. Dan review factor that glucose instability. Apakah faktor yang melibatkan gula mereka tinggi? Adakah disebabkan makan tak jaga? Adakah disebabkan cocok tak betul? Ya, teknik tak betul. Kalau teknik tak betul, as a nurse we have to educate. Okay, being as a diabetic nurse educator, it's always a challenge for me. When the patients, even though we have educated the patients many times, we have seen the patient many times, but masih mereka boleh lakukan kesilapan tersebut. So the reinforcement technique must be there every time whenever they come for the follow up. So kita kena bagi tahu, jangan sekali-kali miss their food, jangan sekali-kali tak cocok insulin, tak boleh. So kita kena bagi tahu. Okay, dan pastikan kalau mereka pilih makanan, pastikan mereka baca label daripada makanan tersebut. Okay. Kalau gula mereka, gula dalam kandungan gula tu tinggi, janganlah kita pilih. So kita kena ajar cara baca label di pemakanan yang mereka beli, ya, ataupun mereka pilih. Okay. Kalau ubat kencing manis, sebab ada setengah ubat tu tak berapa sesuai untuk beberapa individu. Kalau ubat tu tak sesuai, apa kita nak ajar? So pastikan kita boleh still masih makan, tetapi tengok kalau ubat tu masih tidak berfungsi dengan bagus ataupun pesakit ada side effect dia, ya, kesan sampingan. Apa yang patut mereka buat? Kita ajar mereka, pastikan mereka datang ke hospital pada hari berikut dan pastikan mereka bagi tahu dekat doktor yang merawatnya supaya doktor boleh tukar ubat oral ataupun kalau patutnya pesakit kena on insulin, cocok insulin, so kita boleh tukar kepada insulin, ya. Dan jikalau pesakit itu pakai insulin, cocok insulin, semasa mereka cocok insulin, pastikan kita kena check sebab kadang kita hanya dapat insulin terus cocok. Tak boleh. Kita kena pastikan mereka check tarikh luput. Itu sangat penting sebab kebanyakan pesakit lupa untuk buat demikian. Okay. Oh, tengok dah dapat insulin, okay, terus cocok. So kita kena ajar mereka bagaimana kita nak pakai insulin. Sekarang semuanya datang dalam bentuk pen, ya. So kita terus cocok sebab ubat sudah siap dalam pen. Kita start cocok, pakai dos yang diperuntukkan, kita dah boleh cocok, ya. Dan pastikan insulin yang dia pilih, insulin yang dia cocok adalah insulin yang dia patut guna, bukan insulin yang silap. Okay? Sebab kita dah bagi insulin yang telah di prescribe pada mereka dan kita kena bagi tahu sebab setiap insulin adalah berbeza, ya. Kalau insulin itu kena cocok 5-10 minit sebelum, patutnya kena cocok 5-10 minit sebelum. Kalau insulin itu cocok dulu, kena tunggu 20 atau 30 minit baru makan, so kita kena ajar mereka sebab because always the timing is very, very important, ya, untuk nak stabilkan gula pesakit. Dan lagi satu, walaupun diorang ikut segala benda, segala nasihat kesihatan yang kita ajar, terkadang teknik, cara suntikan kalau tidak betul, benda ni pun tidak akan successful. It won't be successful because sometimes patutnya cocok dekat perut, diorang pergi cocok dekat tangan. So kadar penyerapan insulin dalam otot mereka adalah berbeza. So kenapa kita emphasize cocok dekat bahagian abdomen, bahagian perut? Kenapa kita tak bagi mereka cocok di tangan? So kita kena bagi tahu. So kadar penyerapan adalah berbeza ikut suhu badan kita juga. Okay? So kita kena ajar kenapa kita cocok dekat perut. Kalau cocok perut, macam mana nak rotate suntikan insulin? Janganlah kita cocok satu tempat saja. So kita kena cocok ikut rotation macam pusingan jam. Sebab itu adalah untuk bagi penyerapan insulin dengan kadar yang betul. Dan jangan cocok tempat yang sama pula. Nanti kalau tempat yang sama, tempat tu boleh jadi, perut tu boleh jadi keras. Insulin tak serap betul. Kalau insulin tak serap betul, outcome-nya gula pesakit tu tidak cantik, ya. So, nampak macam benda remeh-temeh, tapi sangat-sangat penting, very important for us to educate the patients, ya. So, with that, thank you so much. This is my end of my slides. Okay, so I think that's all. So is there anything that you guys want to ask? So boleh tanya saya.
Okay, thank you, Ms. Premila. Maybe we can continue to discussion for question ask and answer in the discussion session. We will continue to the next session for second presentation. Okay, thank you so much. We have a lot of information from your slide. Now I know how to link between COVID-19 and diabetes. How can COVID-19 infect the diabetes patient?
Correct.
especially treatment for diabetes patient infected with COVID-19, for treatment critical ill. And for the important thing, because we are nurse, I get a lot of information about nursing information intervention for diabetes patient. Especially, we have to educate for blood glucose test, for diet, for insulin injection. So maybe we can continue to the next session, right? We will come back to the discussion session. Thank you, Miss Premila.
Okay, I just want to highlight something. I have a patience because I'm working now. I have a patience to see the patients to teach on insulin. Can I leave the Zoom and can I come back, or how is it? So you want me to leave my email? Maybe you guys can point it out things. I can answer through that as well.
Oh, okay. You want to continue with
how I
question
can help
now?
you? Yeah,
or...
that's right.
Okay, okay.
If there is a question, I'll be happy to answer before I leave because I have a patience be waiting. That's why. Is there any questions? I'll be happy to answer. Yeah.
Yes, I will start the question from our student now, right?
Okay, sure.
Okay, in this link, we have 2 questions for you from our student.
Oh.
Okay. For the first is from Nadia. Nadia is our student. Question from Nadia is, can people with diabetes get the COVID-19 vaccine? Is there a differentiate with general people?
Oh, that's a very good question.
Okay, maybe you can.
People with diabetes, they can get vaccine. Yeah, can I? Okay, can I answer that?
Yes, of course.
Okay, sure. Okay. Thank you, Ms. Nadia, for the questions. Okay, yes, diabetes patients, diabetes people, they have to get the vaccine COVID-19, and they should get it. Depend on the countries that they are practicing, the type of vaccine they actually get it. Because as we know, these are the group of people they should get compared to the normal people. Okay, because these people are actually, as I mentioned of my slides earlier, because these people are immunocompromised. Secara fizikal, mereka tahap immune system mereka adalah pada kadar yang sangat-sangat tak berapa baik. So, pesakit seperti ini macam kita kata, the link between the COVID-19 infections and diabetes is always very high. Because all these patients with hypertension, masalah buat pinggang, diabetic, or some other antibody diseases, mereka adalah memang tahap imun mereka adalah sangat rendah. In case if the patients get the COVID infection, so memang kalau mereka tidak dapat rawat, okay, if they can't be treated, so they can get a lot of miserable outcome. They can get a lot of complications such as death. So, kadar mortality akan meningkat kepada pesakit yang tidak mendapat vaksin COVID-19. So, we always emphasize group kategori inilah yang patut dapat vaksin, and it's a safest because, for an example, I would like to share my own experience where my father is a diabetic, and I brought him for the vaccine, and he's doing very good because it's a protection for him. Dia satu it's a protect from the COVID infection. Okay, sebab walaupun mereka telah mendapat infection COVID-19, then how we can protect, because this vaccine is there in their body to fight against the infection. Even though kalau diorang dapat infection pun sekali, mereka boleh fight because they have the immune system to protect against the COVID-19 viruses. And of course, there is no difference between the normal people, because even normal people getting the same vaccine in our Malaysia clinical practices, we are still getting the same vaccine, and then there is no difference. But only thing is, people with diabetic or any immunocompromised patient, we will give priority for them first to get the vaccine compared to the normal people. Because we have an app called My Sejahtera, because usually the appointment for vaccine will be given through the apps. So they have to turn on the day of the vaccine day to get the jab. This is what we actually following even up to now. Okay, so this is how we actually follow. So patient just come over and then they can get the injection, the vaccine to get the things done. So currently we have our third dose is going on as we call booster, because every people must get vaccine pertama dan kedua, dan sekarang kebanyakan mereka telah menjalani vaksin ketiga ataupun we call it as a booster dose, keep going up. So still go back to the same question, same thing. These are the people. Orang inilah yang patut dapat dulu, ya, so that we can protect them from the COVID-19 infection, ya. I think I have answered that, Miss Nadia.
Yes, a very clear answer.
Oh, thank you.
Yeah.
So any other questions I would like to?
Except for the second question.
Yeah.
Okay, about the recovery rate. From Salsabila, this is our student.
Okay.
What about the recovery rate of people with diabetes who are infected with COVID-19? How they recovery after infected with COVID-19 and how to manage that patient?
Okay, thank you. For the question is Salsabila. Okay, what about the recovery rate of people with diabetes who are infected with the COVID-19? Okay, the recovery rate is based on the level of the severity of the infection. Okay, dia ikut tahap infeksi COVID-19 pada pesakit tersebut. As I mentioned earlier when I was giving this talk, where tahap COVID-19 tu telah dikategorikan kepada 5 level ataupun 5 tahap. Tahap 1, tahap kedua, tahap ketiga, keempat dan kelima. Tahap 1 dan tahap kedua, so if they got infected with COVID-19, okay, so the recovery rate is much faster because the level of infection is very, very low and they actually can overcome the recovery process much faster dengan syarat gula mereka adalah pada tahap yang bagus. Okay, kalau pesakit itu adalah pada tahap ketiga severity infeksi COVID-19 pada mereka ataupun tahap 4, sebab kategori ini memerlukan treatment yang secara intensif seperti mereka perlukan bantuan pernafasan seperti ventilator ataupun mereka kena perlukan makan ubat steroid. So mungkin kadar hospitalisasi, ya, tempoh dia orang kena stay di hospital adalah mungkin lama. Okay, for an example, pesakit tahap 1 dan kedua mungkin dia orang perlu kena stay di hospital atau perlu berada di hospital mungkin selama 5 hingga 7 hari daripada tahap onset mereka dapat infection, so kita kena kira yang tu juga. So kebanyakannya kadar mereka stay di hospital adalah pada tempoh yang agak pendek untuk kategori ataupun tahap 1 dan 2. Kalau tahap ketiga atau 4 dan kelima yang severe tu, mungkin mereka perlukan bantuan pernafasan dan tahap hospitalisasinya, tempohnya memang berpanjangan, ya. Okay, bagaimana recovery rate? Memang cepat. I would say almost 60 to 80% are recover much faster pada tahap 1 dan kedua. But depend on the age group juga. Kalau mereka adalah pada umur yang 60-an dan ke atas, so mungkin peratusan adalah agak rendah, mungkin dalam 50 hingga 60, tapi memang mereka menunjukkan pada satu outcome yang sangat bagus sebab dengan syarat kawalan gula mereka adalah bagus, ya, membanding dengan pesakit pada tahap ketiga yang mereka pakai bantuan pernafasan ataupun steroid, ubat steroid. Mereka tahap recovery rate mereka adalah mungkin kurang sikit, mungkin 40 hingga 50% ataupun 55% sahaja, ya. So kita kena manage yang itu. Kalau pesakit itu lepas dapat infection, seperti yang kita tahu, kita dah for an example I can give you, let's say your tangan memang okey, cantik. sekali kita dah dapat luka, kita akan dapat parutkan. Maknanya kulit kita tak sama seperti dulu, ya. Namun juga pesakit itu memang seorang yang normal. Okay, tiba-tiba dia dapat infection COVID-19. So biasanya COVID-19 virus ni dia efek pada paru kita, ya. So sekali virus tu telah attack, telah jangkiti paru kita, kadar tahap ataupun paru kita tak macam seperti dulu lagi, ya. So telah dikena macam telah kacau, ya. Maksudnya dia tak seperti 100% dulu, sekarang dah hanya tinggal tahap dia baru dalam 85% atau 90% saja. Tak seperti dulu. So memang dia punya recovery rate dia perlahan sikit saja berbanding pada umur, ya. Kalau orang tu agak muda, so kadar recovery dia lagi cepat dan management dia lagi senang. Kalau severity dia sangat tinggi berbanding pada umur macam dia 60-an ke atas, memang diorang kadang-kadang diorang akan rasa sangat letih. Kalau kita perasan orang yang lepas dapat infection, lepas habis kuarantin, kalau nak pergi balik ke kadar asal, kita boleh nampak ada perbezaannya. Masa dulu memang dia nampak okey. Lepas dapat infection COVID-19, kadar penyembuhan dia walaupun bagus, kita boleh nampak ada perubahan dari segi fizikal mereka. Mungkin kalau nak jalan pun dia orang rasa mengah, tak boleh nak bercakap seperti dulu. So we have to see all that. Okay? So these are the things that I'm actually encountering yang selalu saya nampak di clinical area saya, ya. I think I have answered Miss Salsabila.
Thank you, Miss Premila.
Janganlah tutup.
Very clear answer,
thank
and
you.
you share your experience with us.
Sure,
Okay,
thank you. Is there any more questions?
Yes, that's 2 questions from our
Only.
student.
Oh, I see. Okay, thank you so much. Thank you so much for the opportunity, and definitely I would like to thank Prof. Reza and Miss Ayuni Puan Buntar for the opportunity, because this is the first time I interact with our neighbors, friend from Indonesia, all the way from Indonesia. And thank you so much for giving me this opportunity, and I will be very happy if there is any future. I'll be happy to share with you guys. So with that, thank you so much, and I'm leaving from you guys. Please feel free. I'll be just leaving my email. If there is any questions that's coming up after this, you guys can please always ask me. I will be happy to answer. Yeah.
Okay. Thank you so much, Miss Premila. Maybe we can, we can meet again in the sharing lecture, another sharing lecture.
Sure.
Thank you so much for your email.
Okay. Yes. Okay. Okay. Bye. And I'll be happy to leave you guys. And thank you so much. Yeah. Take care and stay safe.
Okay. Thank you. Stay safe.
Okay. Bye bye.
Okay, that's from Miss Premila. Before going to the next session, I would to remind the participant to fill the attendance list. Especially, I want to say hello to the international student from Malaysia and Thailand, who in this room, Muhammad, Niluh Gede Susanti, Nurhayati binti Hamzah, Nur Hazima, Rozia, Saraswati, Sarian Bahrin, Satisna Fani, Sirin Majida, Siti Aisyah Mary, Umi Fatida, Zainurida, Indra Velanita. Please fill the attendance list in the link of that we share in chat room before. You can see that link, and please fill that link. And now we are going to the next session. For the next session, we have second presenter or second speaker from Akademi of Nursing Pelni JAKARTA, Miss Fazar. Okay, Miss Fazar, for the second speaker today, will presentation about diabetes mellitus type 2 and its complication management based on evidence base. Okay, Miss Fazar, please welcome. Time is yours.
Okay, thank you to Miss Ayuni. I like to share my screen.
Yes, sir. Yes, we can see your screen very
my
clear.
Screen. Okay,
yes.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Today we will discuss about diabetes mellitus. But first, I want to say that actually Miss Premila said that clinical management in Malaysia is really clearly that we already heard today. And I think it is more deliberate if we have more communications or discussion about their nursing management in diabetes, and we can compare to in Indonesia. But let's discuss with Ms. Premila that has left her email. Yeah, is it right, Ms. Ayuni?
Yes, that's right. Ms. Premila sent that email. If there are questions from us and want to ask more about anything for diabetes, we can send email to Ms. Premila.
Okay. I'm not going to be discussing about diabetes anymore, but I want to focus about IBN. Diabetes mellitus is a complex metabolic disorder characterized by elevated blood glucose concentration secondary to either resistance to the action of insulin, insufficient insulin secretion, or both. There are two types of diabetes, type 1 and type 2. And type 2 diabetes is the commonest of form diabetes and is characterized by disorders of insulin resistance and insulin secretions, either of which may be predominant features, like Ms. Premila said before. So how about diabetes around the world? In Indonesia, we have 19 million people. It is such a high number in Indonesia. Even Indonesia is a small country, but we have burden of disease, diabetes, in 19 million people. And interestingly, burden of diabetes in Indonesia report by IDF, we are in the 5th rank in the world as a top 10 countries who have a number of people with diabetes. It is about 19.5 million, and it is compare and projection to 2045, and we are in the still same place. It is 5th rank. We have 28 and 28.6 million people who suffer diabetes in Indonesia. This is really a serious problem. And interestingly, Malaysia didn't allow or didn't enter in this top 10 country. Maybe they have a good management in diabetes, like Ms. Premila said. And this is the prevalences diabetes mellitus over 15 years. They have been diagnosed. The data from 2011 from Akademi, it is about 8.5 and compared to 10.9 million people who suffer diabetes in 15 years old since they have diagnosed. Microvascular complication of diabetes have presented by Ms. Premila, so I'm not to explain it anymore. I thought that you already know about the microvascular complication diabetes, and this slide is the same too. And pathophysiology has presented too with Ms. Premila, like Ms. Premila said before. So what we can conclude about diabetes mellitus Indonesia? More than 10 million people in Indonesia have diabetes, and 3 times more have prediabetes and are at high risk for development severe disease. in medical knowledge, in medicine clinical, they have evidence-based guidelines support multifactorial approach in patients with diabetes, including lifestyle intervention like physical activity, pharmacological treatment of hyperglycemia. They have metformin, and anything else, hypertension, and dyslipidemia. So how about nursing in diabetes care plan? I want to focus in nursing management. Ms. Premila has presented in clinical management in Malaysia. So I want to focus in nursing management in Indonesia. In Indonesia, we focus on four points. First, we know that hyperglycemia is the most common life-threatening, which requires immediate nursing management. Therefore, nurses must recognize clinical manifestations and then control the blood glucose level and monitoring into the plan of care. And the second, macro and microvascular complications. Nurses need to assess complications of type 2 diabetes mellitus, providing education relating on care of plan as well as healthy dietary intake, physical activity, and prescribe are needed. And the third is outcomes. It is depend on patient case. Maybe for patient experiencing osteomyelitis, the expected outcomes, patient will have exhibit wound healing and there are no pus or gangrene wound. So you must to make sure that patients have no osteomyelitis for the better outcomes. And then the last is collaborations of care. In Indonesia, multidisciplinary team members need to be activity involved to ensure an effective approach with shared responsibility and decision making. So they include endocrinologists, nurses with wound care specialists, diabetes educator, dietitian, and many other interdisciplinary team depend on their complications. This is the theory of collaborative approach. We need to propose to our healthcare system. Every healthcare team needs to define roles and responsibilities, and healthcare team needs to effective and establish communication, understanding the patient journey, and how to approach a patient in clinical setting. This is the multiple complications in diabetes mellitus, and if they have brain and cerebral dysfunction, they refers to neurovascular specialist, or heart and coronary circulation, they will refer to cardiologist. And so all of the complications matters who suffering diabetes mellitus. And next, this is the key concept from current research they have proposed to apply in multidisciplinary team members for another hospital. So we can see that this is not really different about how this is applied in our clinical setting. Okay. And what I need to know from you guys, I want to share about evidence-based in nursing. Maybe this is one of my research that I did when I'm in the school as a nurse, as a resident. I proposed to emotional distress and application evidence-based nursing in patients with type 2 diabetes mellitus. We know that stress and diabetes mellitus has connected, interrelated pathophysiologies. If someone has distress or stress as mental stress, they will increase the blood glucose level in patient with type 2 diabetes mellitus. So in Cipto Mangunkusumo hospital that I experiences in residence, they get stress in high level. So the aim of study was to screen about emotional distress in patient type 2 diabetes mellitus. And evidence base of nursing in this study, I am using PICO model, like a problem, intervention, outcomes, and corporation. And this is for 60 patients using PAID screening. PAID is problems areas in diabetes. So what's the result of this EBN? The result of this PAID screening as implementation evidence-based nursing was interestingly 27% patients get distress emotional and 73 patient was compensated emotional. It is a high gap and big differentiation, big difference about the score. So what about 27% who get distress or who experiencing a distress emotional in hospital? And this because they didn't follow up by the nurse and they get they don't have many communicate about their disease to the healthcare team. And 73% who experiencing compensated emotional is because of distress emotional has resolved during their hospitalization. So they know about their disease, they understand about how to treat the diabetes since they are in hospital, and they get support from a family who have educated by a nurse educator. For those who experiencing distress emotional with score over 40 points, which is 27% get distress, it is associated to diabetes treatment, including losing control of blood glucose level, negative behavior, they neglected to get the treatment, financial problem, and hopeless about the disease. This is because they don't get any educations or don't know about their disease. They keep silence and doesn't want to get treated because it is they have a financial problem. So as a nurse, we need to make sure that our patients need our help first, and then we need to understanding the journey of the patient, maybe because the financial problem or they scare about the treatment. We need to educate. That's why we need a diabetes educator. So what we can conclude about this PET screening, we can use this score to improve or to submit it to the basic data to make a good nursing care plan for type 2 diabetes patients. So this data we can propose to the doctor or physician or dietitians that the patient has an emotional distress. So we can propose how to make a good communications and establish the communication with patients and their family. This is questionnaires that I'm using in paid questionnaires, original research in English. So I translate it to Indonesian language in order to patients can fill in the answer by their own language. So I hope you guys can use these questionnaires too with your own language, and you can use the score to get to know how to prevent emotional distress and how to manage a patient with type 2 diabetes mellitus regarding to emotional distress. So I think that's enough with my presentations. Thank you, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Ms. Fazar, for your presentation. From Ms. Fajar presentation, we get information about macrovascular complication diabetes, multiple complication, especially about evidence-based nursing. That's about the physico-emotional distress in diabetes mellitus. And from that questionnaire, we know how to prevent management stress in emotional diabetes. Okay, now time for question. Let me check the question for you. Okay, being a participant, if you have a question, you can raise your hand and you can open your mic and say it directly to Ms. Fajar. Ya, bagi yang punya pertanyaan, silahkan menyampaikan langsung pertanyaannya kepada Ms. Fajar. Bisa membuka mic-nya atau membuka kamera dan menyampaikan pertanyaannya.
Okay. Maybe because I'm not explained about the clinical management, because Ms. Premila has presented before, so I am focusing on nursing management in diabetes mellitus. So if you have a questions, you can ask me or we can discuss by my email if you don't have any questions anymore.
Okay, first student, all participant, any question? Okay, Ms. Fajar, maybe we can discuss about your questionnaire, right? For the paid questionnaire problem alias in diabetes questionnaire. Right. I see from your questionnaire, we can see clearly where is the part of diabetes patient is problem, especially in emotional distress, right? Because the point of the question is really clear when I see this. That's really give much benefit for the diabetic patient. And for the example, here is 16, right, Ms. Fajar?
16?
Oh, okay, 16. And how the methods about this research, you give that questionnaire for the patient one by one in the rawat inap or poly?
Okay, I did it to all in inpatient, not in polyclinic, because this is one of my tasks in the end of my residency study. So I have 60 patients in ward room. So they get some patients have their emotional distress, and I did my own research, not with paid questionnaires, but just asking about how they're managing diabetes. So most of them said that they lack of hope to get treated in diabetes, and they really need help, but they want to tell to healthcare team because they scare. And if they have a treat in diabetes, they will face the next problem, like a financial problem or support system to their family. So they prefer to treated their disease into clinical private in their environmental or in their residencies. So there are something fishy that how they don't want to treat their diabetes. So I take my research topic about emotional distress, and one of the most special answer, they really want to treat it, but they want to keep silence, and everything is about emotional distress in their self by the patients in type 2 diabetes mellitus. So the aim of study was to screen about emotional distress, how high the emotional distress when they get or they have treatment in hospital.
Oh, okay. That's really give much advantage from this questionnaire, right? Because we can screen that patient. Is that questionnaire used in hospital, Ms. Fajar?
Pardon me?
Is that questionnaire used in hospital?
Yes,
in emotional distress patient?
Ruang B Mawar in hospital in Cipto Mangunkusumo Hospital. Miss, I'm not sure about his name, but the manager of nursing said that this screening was used by the nurse to screen the emotional distress, and it's really helpful, but not for all the ward using this PET screening, because I just said to the bidang keperawatan, Miss Yunisar, that it is necessary to use using this PET screening for nurses in their hospital.
Yes, because I think the diabetes patient really need this screening, because as we know, diabetes patient have a long time treatment. They have to go, yes, they have to go to the hospital. Yes. Of course, that situation give distress to the patient. Every day they check the blood glucose. Every day they injected the insulin, and I think that very give much benefit. Okay, for the participant, there are questions for Ms. Fajar.
Mbak Ayuni, ada Prof. Zahara, selamat datang, selamat bergabung.
Oh yeah, Prof. Zahara, welcome to the honor of Prof. Zahara as a Dean of Nursing and Midwifery Faculty, MAHSA University, Malaysia. Welcome to Indonesia by Zoom meeting.
Prof. Zahara?
Nggak apa-apa, lanjut aja. Lagi ada acara juga sih.
Oh ya. Okay. Thank you, Prof. Zahara. Now is third question for Ms. Fajar. Okay.
If there are no questions for me, you can send by email if you have any questions, so we can discuss more clearly for
yes.
students.
Yes, thank you, Ms. Fajar. Ms. Fajar will send her email to the chat room. If participants have a question, you can send email to Ms. Fajar. Please, Ms. Fajar. Okay, thank you.
Thank you, Ms.
In this chat room, Ms. Fajar have an email. Okay, now when I see the time, I think time is up. We are in the end of the session of Sharing Culture program. Today, we have got a lot of information about diabetes, especially about application of evidence-based nursing in the diabetes nursing intervention, managing diabetes during COVID-19 pandemic in Malaysia from Ms. Premila, and diabetes mellitus type 2, its complication management based on evidence-based nursing from Ms. Fazar. Okay, once again, thank you so much for Miss Premila, Miss Fazar, and Miss Guntar Handayani as the Director of Akademi of Nursing Pelni Jakarta, and Prof. Zahara as a Dean of Faculty of Nursing and Midwifery, MAHSA University, Malaysia, and all participants in this sharing lecture program. See you in another sharing lecture program. Have a great day. See you next time. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Okay, please, for the all participants, open the camera. We will take a picture in the screen, of course, not in a direct because we are in the daring, right? Okay, please, Pamumu, you can take a picture for us.
1, 2.
Okay, for the first screen, please smile and open your camera.
1, 2, 3. Okay.
Okay, for the next screen, we have 4 screen here.
Okay. 1, 2, 3. Next.
Okay, for the third screen.
1, 2, 3. Next slide.
Okay, this is the last screen.
1, 2, 3. Okay. Sudah, Bu?
Pamumu?
Sudah.
Okay, thank you so much, Pamumu. So, see you next time. Again, wassalamualaikum warahmatullahi wabarakatuh. Thank you so much, everyone.
Thank you, everyone.
Stay healthy.
Malaysia.